Hello, and welcome to this podcast. Again, this is a part of the series that we are doing for International Women's Day. This will be focused on a different aspect of women's health. We have covered two different issues that are very, very important. Today, we are going to cover something that a lot of women are going through very early, and that is menopause. Why is this happening so early? Do you know anybody who is suffering from it? So, if we want to unravel these mysteries of why it is happening so early, what are the things that women need to know about it, and what can be done to alleviate the symptoms, to reduce the risk of chronic diseases later on? Here we have with us Dr. Anagha Karkhanis, Director of Cocoon IVF and Gynecology, with several years of amazing experience helping women achieve their dreams and also improve their health in terms of whatever issues they might have. So, one of the things that we wanted to address, welcome Anagha, firstly, to our
Thank you so
podcast.
much. Thank you.
Thank you so much for being with us. So we would like to begin by starting with, if we look at the issues that women are facing these days. If we think about the issues that women in their late 30s, early 40s are facing, what are the kinds of things you see in your clinic? Because we have seen a lot of women going through early perimenopause or menopause. So is that something that's very common? And what are the reasons? What are the causes for this?
So, menopause, how we define that is something that happens after the age of 45, and when a person has stopped having a period for at least one whole year. So, an average age is somewhere around 51. So, the range is between 45 to 55. That is the time most of the women will have their menopause. Now, when it is happening before the age of 45, then we call it like early menopause. So, and like you said, in my practice, yes, I we see this very often because we treat fertility issues. So, early menopause is one of the prime causes where we call it like premature ovarian insufficiency or ovarian failure. That is when the ovaries have stopped doing what they're supposed to in the reproductive age group. And that means they have stopped producing the required hormones and growing eggs. And that is an early sign or a symptom that we see. So a lot goes behind that. I mean, there are like at least 20, 30 reasons. There are different syndromes which are there. One is like idiopathic, where there is no reason, but everything is fine with the lady otherwise. But it's just that the ovaries have stopped working before time. Many times we need to ask the patient about the history of menopause in their mothers, aunts as in mothers, sisters actually, and their own sisters, and that is where the linkage can come from. So genetically, there might be a predisposition to early menopause running in families, and that is a history that is very very important to note down before we start any fertility treatment. So ideally, like early menopause, we say, and nowadays we have a terminology called perimenopause. So perimenopause is this transition that, because menopause is not one single day actually, that okay, today you're menopausal. It's not like that. It's actually a time period, and it may last for months and years together, that a woman goes through. So usually the early perimenopause is something when the symptoms of menopause, they have just about started, primarily being the spacing between periods increases. So it could range from say 1.5 months, 2 months. So they start spacing out, and some symptoms start coming, like hot flushes being a common thing, night sweats being a common thing, and eventually this spacing becomes longer and longer between the cycles. So it will go on to, from I'll say, like say 6 weeks, 7 weeks, 8 weeks, it will go on to like 2 3 months, 4 months. They become more erratic, and one fine day they will stop. And so when they've stopped for a whole year, then we call it a menopause. But it is a time period, it is not one particular moment.
Yes. So you've explained it very well what exactly happens during menopause. So we are seeing women go through this much earlier than they used to, or women who used to a decade ago, 2 decades ago. We are seeing this becoming more and more common. So it is something else to deal with when menopause is happening so early. Women are opting to have children much later, and then menopause is also happening very early. So could you relate this to poor lifestyle, gut microbiome, or
Absolutely.
things like that? Because we are focusing on the gut
Absolutely.
microbiome, and there's a
Absolutely.
huge need for
Yeah.
people to understand.
I think this whole lifestyle issue is it's taken for granted because we have become more probably robotic in our actions of having say maybe starting from the morning, say having packaged food, processed food. That's a lifestyle thing. That is a dietary thing. Lack of exercise, lack of good sleep, lack of that tranquility. Also, those things also come into picture. Then alcohol, smoking, all these things, yes, we see an aggregate effect not only on the men on females reproductive function, on menopause, in other actually systems also. If you look at like cardiovascular, gut system, everything. And one thing, yes, we have always believed that if your gut is healthy, your everything else is healthy, because what is in there is governing the rest of the body. So somehow, obviously, smoking, alcohol, these are the now lifestyle changes that now more and more women are into it than what they were probably 50, 60, 80 years ago. So that is the change that is happening in the system. And that is, and it is, then we see a translation into different medical streams, in the sense of early menopause, early, like we say, ovarian insufficiency, or ovarian premature ovarian failure. These things are a translation, or even polycystic ovaries, many things actually. I mean, if we just sit to name, we can fill up pages of problems which are happening because of the derangement in the gut biome, and these lifestyle changes. Yeah.
Yes. So thank you so much for this comment, because lifestyle is something that is the need of the change is really needed. People are going through these lifestyle issues as if they are optional. Poor nutrition is very very common. Sedentary lifestyle is very very common, and instead of looking for our ancient practices or ancient traditions to see how the diet should be. It is the influencers who are dictating what the lifestyle and what the nutrition should be, instead of doctors or probably grandparents telling us what we should be eating. It's becoming more and more of a serious issue when we have youngsters looking at influencers for nutritional advice.
Yeah.
So it is something that is a very, very disturbing trend. And when we see women going through all of these issues of perimenopause, menopause, when they are not ready, they're not expecting it at that age, they are not prepared
Yeah.
for it, and they don't know the symptoms. So if we talk about what
Right.
symptoms they are going through, they have no idea that this could be actually perimenopause or menopause. There is no
Absolutely.
emotional support because it's a nuclear family. Most people are not even aware of that. So, what are the
Right.
things that women should be looking out for? And some women have very mild symptoms, some have very extreme symptoms. So, what is it that women should be looking out for?
Some, and also some women might be very lucky, they'll have no symptoms. They'll
Okay.
pass through about 10% or less will be lucky, I would say. It's like pregnancy also, na, some women escape without
Yes.
any nausea, vomiting, anything. It's like that. Some might escape, but up to 90% women will have some symptoms, and it's very important. So they should know at least what is happening, because especially, see, the what happens in menopause is there is a lack of estrogen. The ovary stops producing estrogen, progesterone, testosterone. These are the hormones which have been protecting a woman in all her reproductive age group, that life. And once they go down, the protective function that they had on the bone, on the heart, and on the brain, which we really miss sometimes, that function also is compromised to a degree. And what is that? So right from irritability, mood swings, lack of concentration, memory is affected, and these are the things that will affect the woman more. But apart from that, the symptoms that she should be looking out for are particularly, like I said, the spacing out between the periods, the periods which were coming regularly. First, say she was getting 28-day cycle or once a month properly, now it will start slowly spacing out. The spaces will become longer and longer, and one fine day the periods will stop. Another thing is, the commonest things in of the symptoms is the hot flushes, night sweats. So suddenly, the room might have air conditioning, everything, but this particular lady might just break out into sweat, and it's very embarrassing, and it gets very how do you say, disturbing for the lady to be sitting in a group of people where everyone is fine and suddenly she's sweating. So that is a commonest thing. Apart from that, disturbed sleep, like I said, we should, the brain function is something that should be paid enough attention to in the menopause. And like you said, they don't get the emotional support because there's no understanding why suddenly she has started behaving like that, why suddenly she's getting mood swings. People don't understand, but it is, they really need that kind of TLC, tender loving care, and understanding from the family, friends, and whoever is around. So that, and also you see, that is an age group when children have kind of maybe grown up, they're in the teens, or they're college going, or they're married, or whatever. So that is a particular time when anyway she's more so on her own, because children don't need the mother as much as a school going child would. She's already feeling alone and she's already going through the mood swings. You see, there's a, that age group also, there's a transition. That age group, you're looking after old parents also. You're, so that's a particular time in a woman's life that needs to be paid attention to. So like disturbed sleep, insomnia, then low mood, anxiety. Apart from that, other symptoms like palpitations, anxiety, and all can be there. Yeah,
Yes.
so apart from all this, disturbed sleep or insomnia, anxiety, palpitations, something that, another change that happens in that time is vaginal dryness, because again, because of lack of estrogen. And that is why difficulty in intercourse, also lack of libido, all these problems start. And also something we called genitourinary syndrome of menopause, GSM. Here there'll be newly formed urinary complaints like painful micturition, and other problems start, which are again urinary complaints start. Sexual complaints happen, anxiety and mood related, heart related. So, and things that we cannot see otherwise are the bone changes and other things that happen as well. So one thing is, so once they are aware, at least they can go investigate things, and also as required take the medical help that is available, actually that is available, but people, like you said, are not aware what to do.
Yes, so there are some very important points that you covered. I'll just take them one by one. The one thing that we have noticed many women talking about is that many of them have teenagers when they're going through this, and the women are not aware of being in that stage of perimenopause. And the teenagers are going through their own teenage, the changes, hormonal changes,
Absolutely.
and then both are screaming at each other. There are screaming matches at home, and nobody understands what is happening.
Why?
So that is something that is very, very common. I've heard from many women, and then they later realize that, oh, this is why this happened. This is
Yeah.
why the lady of the house was screaming because she was going
and
through
and
perimenopause and
the
nobody
most
knew about it.
neglected person in any house is the mother, because she's actually looking after everyone, everything, but she's actually the center of everything that is working right in that house, that family, but she's the most neglected person. Yeah, in any family,
Yes. So if we think about
not India, abroad, Europe, any place, that is
anywhere,
how it is. Anywhere.
anywhere she's taking care of the house, not taking care of herself. And 40s is probably the most productive stage even in a career if the woman is working outside. So that is something that having to juggle her own career, dealing with hot flashes, and making sure other people do not notice what is going on, and not knowing what is happening herself, not knowing that she is going through all of these, ignoring her own health, is so common. Only when it reaches the last stage where the periods actually stop does the lady realize that, oh, this is what was
I
happening.
was going through menopause.
And
Yeah.
I wish I had known this before. The family
Correct.
doesn't know. So this is something that we need to create awareness about. That this is what might be happening in your lives. Are you screaming at your teenagers? Is this something that's a common scene in your house? Maybe this
Or
could
your
be the reason.
husbands, or your husbands,
Yes,
that is
or husbands.
more
Yes,
common, I think.
definitely. Definitely. So there are symptoms like this. Some have extreme symptoms. What
Yeah.
are the reasons? Again, we can correlate that to poor microbiome, dysbiosis in the microbiome, because the microbiome is going to regulate how estrogen is metabolized in the body. It has a lot to do with estrogen. And when estrogen starts going missing, the levels are dropping, there are all of these symptoms that you just talked about. So this is one of the reasons why people have a range of different, some have very mild
Yeah.
symptoms, some have no symptoms,
And
some
it's a
have
vicious
too
circle,
many
right?
things
The,
going on.
the microbiome goes down, the
Yes.
metabolism is affected. When estrogen, progesterone, testosterone is not in, rather more so estrogen is not there, the gut microbiome goes down. So it is like somewhere you have to break this cycle, because the estrogen is going, you're going to have menopause is going to happen anyway. So at least the gut biome should be kind of replenished, and so at least the health wise her severity of symptoms would at least ease off.
Yes, there is a significant difference in the range of symptoms that women go through based on how their health has been, whether they are exercising, how healthy their lifestyle is, how healthy their food is. So,
True.
there are many other things also you spoke about mental health, emotional health, that is also impacted very significantly at this stage, because it seems like women feel a lot more helpless, a lot more alone, not supported at this
Yeah,
stage. They themselves
vulnerable
don't know
basically.
what is going on. So, what are the things that do you recommend something to your patients? What are the things that you tell them to do?
So I usually what I do when somebody comes in that setting, I also see to it that the family member, usually the spouse, they are also aware, and so at that point in time they need to be more understanding of the situation. And because if she's going through a spiral, and if she's and if a banter starts, then it is going to only worsen. So we need to educate people around that, listen, this is the thing, and slowly she will, we have now the medication is on or something, or even general lifestyle changes she's bringing about. She started supplements, she's, other things are happening, but also she needs that kind of care where obviously the severity will reduce. I mean, there are so many conditions in medicine with general care and general TLC, we say, are really taken care of. Medicines will work, they'll take their time, and how they are supposed to work, they will work fine. But these other things will help the effect of medicines also. So that is one thing we need to do. Other than that, for the woman herself, it comes as a part of, we can say, complementary therapies to add on. Then she might, she should ideally, apart from general exercise and diet that we mentioned, things like yoga, meditation, that takes care a lot. And in cases where it is also needed, CBT, so cognitive behavioral therapy, is for patients who are finding it difficult to cope up with the psychological stresses associated with menopause. So that is something also we can, we basically ask them to do. Now our patients also come back and tell us, like, many people try acupuncture and all, and that has helped people. So it is, it's whatever works for the person. Actually, it's an individual thing. For somebody, music therapy might help. For somebody, something in particular might help. So ideally we say something that would, like, taking up the hobby of their choice, or taking out that 1 hour of in the day, that me time, is very important. And yoga, meditation, and some exercise. It need not be going to a gym necessarily, or lifting weights, or muscle building. We don't need all that, but just a brisk walk, something, or cardio aerobics, or something that they can even do at home, or just, without any, how do you say, any specialized help. They can still do things on their own. So yeah, this is something that we say also to mention. If there are psychological issues and all, and if a person is taking alcohol too often, more than they should, and those changes, if, when we do that, will also have a positive impact on the mental health. Because
Hi, I'm Dr. Rashmi Kulkarni, co-founder of Arnagen Next Solutions, a microbiome resource platform where we provide all of the resources that are required to improve gut health. These include digital courses about the human microbiome, research related to the microbiome, apps for improving habits in children. We also do webinars and outreach programs to educate people about what gut health is and what our microbiome is, how we need to improve it. So we also have a total transformation program called Shatayushi 360 degrees total transformation that focuses on improving gut health, thereby preventing or even reversing several chronic diseases. Do look at our website www.microbiomesuperhero.com. I hope you enjoy this podcast.
After all, alcohol is a depressant in the long run, so she needs to be educated about her lifestyle and these complementary and or alternative therapies that we say that can help her with the psychological stresses that she undergoes during menopause.
Okay, it's very important that nobody thinks about addressing any psychological issues or mental health issues. That is something that everybody needs. And especially at this time when the hormones are changing so much, this is a very important thought that you have brought in. I'm very glad that you address this aspect. Now, if we talk about other things that are happening, you already mentioned that cardiovascular health, overall health, it's changing because estrogen levels are going down. So, if we think about the risk of chronic diseases these women have who have gone through menopause, because hormonal levels are totally different, how calcium is absorbed in the body is totally different. So, what are the things they should be watching out for? Because now their risk of diseases is different than it was before this perimenopause or menopause. What are the things? What are the types of cancers? What are the types of chronic diseases they should be watching out for, and the annual checkup or whatever they need to do at this age?
Right. So, particularly anyway, in this age, like you said, the estrogen goes down. And because of that, whatever protective effect it had in the reproductive age group, that is suddenly gone. It suddenly goes, that means what things she was protected from before, like her cardiovascular health, that has gone. So, the risk becomes almost as equal to what a man has a risk of cardiovascular accidents or like we say myocardial infarctions, heart attacks, raised bp, all these problems, high cholesterol, all these problems, they start that estrogen which was protecting has suddenly gone away. So a woman is as much as at risk as men. And in fact at that age the cardiovascular mortality is also significant. So that is one thing. Another thing is the because estrogen protects the bones. Once that has gone down, the bones start thinning and they become porous, and she starts suffering from osteoporosis. Now, that is not something that she'll find out, like how the other hot flushes and all the insomnia, night sweats, and all those things. These are her symptoms, but unless the first sign of the osteoporosis might be after she has had a fall. Once she has had a fall, then she is bound to suffer from a fracture easier than what she would have in her reproductive age group when her estrogen was normal. So any fall after this period becomes kind of more risky for fractures. So that is one thing. So cardiovascular issues, osteoporosis, and like we said, the brain function. So at that age also women are, of course, like we said, they're working, so the time of work that the person needs to take, the holidays she might have to apply for extra, and the lack of concentration in work. So these are some problems. Apart from that, age related risk of breast cancer generally is there. So if person has a history of that in the family, and irrespective of that, a person should, as planned, mammography tests and all they should do. And they should watch out for that is self breast examination is something they can do. And any lump, any kind of derangement from anything that they feel was not normal and was not there before, they should get it investigated. They should go to a doctor and get it tested. Usually other cancers that come with age, which is not so common if there is generally no history, but if they undergo, like, it's not even regular, but even like at that age, once you undergo an ultrasound to see that everything else is fine, like your ovaries are all right, the uterus is fine. So we are kind of, we are okay then to, and like we said, the mammography. So breast, uterus, ovaries, that is one thing. Now coming to, also now cervical cancer is in talk a lot after the vaccination is available. Of course, the vaccination taken earlier in age gives that much protection. After a particular age, it's not that it does not give protection, but the protection is less. It's less significant. Nevertheless, she should be sure that she is doing her regular cervical smears as planned. Now it depends on what her previous her previous pap smear result was, and accordingly the timeline is decided. By the age, usually till 65 they do, unless there is an abnormal one, she might need more smears, and then the gynecologist can take a decision what is to be done. In case when all are fine, after that 65 she can drop it then. Yeah, so these are some cancers that we take care of, as in at least we screen and everything is fine. The whole point is, if we pick up something very early, it's totally curable, right? So a life can be saved. So that's the whole point.
Wonderful. So those are the things that women should be testing for regularly, so that if there is anything abnormal, it can be picked up early. And if you talk about heart health or osteoporosis or anything like that, which is related to lower estrogen levels, so what are the things that women can do in order to maintain the estrogen levels? Is there anything natural that they can take? Can they add something to their diet? What do you recommend for that?
So for the east, so we have like two aspects. Like, one thing we spoke about, lifestyle changes, the complementary therapies, and HRT. So HRT actually we didn't discuss, but it's the commonest and the most effective treatment for menopause. That is hormone replacement therapy. So in that, the estrogen is replaced. Basically, once you replace that, the person will have all the symptoms, will the especially hot flushes and all the vasomotor symptoms, we call them, night sweats and all that, because most of the women are troubled. 80%, 80 to 90% are actually suffering from that, if not the other symptoms. So those kind of are well taken care of. It's just that if we are giving estrogen, and if the she's already menopausal, and if the patient has a uterus in place, she has not undergone hysterectomy, we have to also add another progesterone, just to be sure, because then that is a way to basically reduce her risk of getting a uterine cancer. Coming to, so that is HRT, estrogen, progesterone. We sometimes have to give even testosterone. When the primary complaint can be different in different women. They do not all come with the same or complaint. Like, we have these 10, 20 things that could happen, and let's say some are very lucky, they have no problem at all. They just pass through menopause just like that. But yeah, so some women may, the primary complaint may be lack of libido. So that, if that is a problem, then testosterone might help. Now that, and dryness of vagina, again, then we can give them estrogen creams or something, or gels for the local application. uh, these things are very much available, and they are, I mean, you don't even necessarily have to take tablets for everything. There are patches which are available, gels which are available. So that is so the compliance, patient compliance is very good. Apart from this, in the diet, like we said, the gut bacteria are important. In some way, if we can replenish that, we should counsel them, tell them they should take that. Apart from that, the food that they take should be balanced, in the sense of avoiding saturated fats, salt, because they also at this particular age need to keep their the blood pressure in a normal range, because like we discussed, this is an age where the protection from estrogen has gone, and they are more likely to have high cholesterol and myocardial infarcts, and all the risk increases. Now, calcium and vitamin D obviously has to be, the diet has to be rich in that, or if it is not, then might as well take some supplements, because that is how we can protect the bone health along with HRT. And yeah, and very important, like we said, avoiding smoking, alcohol, that is one thing. And complementary therapies, like we discussed, some women benefit with acupuncture, then yoga, meditation, and other therapies. Suppose there are herbal and other things available, and natural remedies. But one thing that we have to remember is, if we are taking also HRT in some way, or HRT is contraindicated in some lady, that means for the estrogen component or something, she cannot take it for some reason medically, then it is hard to say, because the natural remedies or herbal things might have ingredients in them which can mimic the estrogen. So for that reason, if HRT is contraindicated, then they should not, just because some things might be available over the counter, they can directly go to a shop and buy, but that can be risky if she is not allowed, supposed to take HRT. So because patients, generally, we do get a lot of products which are OTC. You can just buy online, you can buy from anywhere. And so they feel that if they're not supposed to take allopathy, they can take that. No, but they might, those things might have ingredients with chemical compositions that mimic estrogen. So they still need to talk to a doctor before they take anything. Yeah.
Yes, those were some amazing points. Do you also recommend phytoestrogens in the diet? Is that something that is common?
We do, in fact, sometimes in the fertility practice also, because that improves the lining of the womb. So yeah, phytoestrogens is something we do discuss with our patients. Yeah, but yeah, we do that. Yeah, and the bioidenticals. So yeah,
Sounds good. So, if we talk about yoga, meditation, and all of the things that you just discussed, they are also going through improving the gut microbiome. There are several studies that have shown that
right.
150 minutes of exercise every week and meditation help improve the diversity of the gut microbiome. So, this is all linked. We could say that healthy gut microbiome is
Everything
going
is
to
linked.
prevent all of these symptoms from being so severe. It is going to help,
Correct.
delay the onset even. So we would like to hear some, concluding remarks about what you think about how healthy gut microbiome can help alleviate all of these symptoms and be a
No,
lot
I
healthier.
completely agree with you. But your topic is menopause, but the gut microbiome is going to help everything, every problem. Because like we just discussed some time back, gut is kind of a source because what is going in or how the health of the gut is, even your mood. Mood is something that goes with that, and apart from all other systems of your body, be it your heart, your liver, your kidneys, your reproductive system. And so that balance somewhere to keep and to maintain that gut microbiome is going to be of help not only in this menopause and gynecological things. It's going to have, it has a wider and much wider scope because it's a general, like you said, yoga you might do for a particular thing, but it will really take care of other things in the body as well. Or meditation, it's going to really help a lot. So yeah, in my field I can definitely say all these complementary therapies like we discuss, yoga, meditation, maintaining the gut health, and all these have a major role. And I think people are now understanding, although like you said, there will be a category where that follow maybe the influencers. I think the influencers should get educated about this so they can advise the viewers, because that is how nowadays the root of education is. It's more online, it's more insta, it's fb, or whatever platform children are on. And from that age only they should understand what good health means. And then in the future we won't even have to discuss this, it will become a routine.
Yes, thank you so much. It is important for people to understand who are the real influencers. That's why we are bringing people like you, doctors like you, who use this knowledge of the gut microbiome and who advise patients that they really need to work on gut health in order to improve all parameters of their health, whether it is looking at all any of these symptoms, feeling better, leading a healthy lifestyle, preventing all of these chronic diseases, and everything related. So this is why the real influencers are people like you, doctors like you, who are using this information to improve, patients' lives. This is not something that is very common. It is unfortunate that people look at influencers who are, there are more in numbers who are not actually knowledgeable, but who are promoting all of these false notions about nutrition, about exercise, and these are leading to a lot more health issues. So thank you so much for all of the enlightening things that you have talked about for this particular podcast about menopause, about perimenopause. I so I hope the viewers can learn from this, and it has been a very enlightening podcast. I have learned a lot about how you are using it for the benefit of all of your patients, and it is really amazing. Thank you so much. We are going to promote this even more. We want people to learn about gut health, and what better than listening from a doctor like you who is actually using this in the clinic. So thank you so much, Anagha.
Thank you
You
for
had
inviting me.
wonderful insights.
Thank
Thank you
you.
so much.
Thank you.
So, viewers, if you have any of these symptoms that Dr. Anagha Karkhanis just described, and you might be going through perimenopause or menopause, watch out for these symptoms. It is not something that women are expecting to go through in their late 30s, early 40s. It is not something that women are looking out for when they're busy with their workplace, with their homes, with their families, and they're not taking care of themselves. So do take care of yourselves. Watch out for these symptoms. Do follow the tips that Anagha gave for alleviating these symptoms. Do see your doctors if you're facing anything like this. And of course, focus on improving gut health because that is the basis for improving all parameters of health. Do consult your doctor, and we are bringing in such wonderful topics in our subsequent sessions. I'm sure you're going to enjoy them a lot. So stay tuned for all of our podcasts on this channel, your own Microbiome Superhero podcast.